So these, this is the crutches, and we're just gonna show the fitting for it. So right here, we're gonna show that you can fit 3 fingers. Yeah, 3 fingers right in here, in between the armpit and the top of the crutch. Here, the handle of the crutch is hitting right at the wrist crease, and when she puts her hand on there, there's about a 30-degree bend at her elbow, which is appropriate. And in standing, we want the crutches about 6 inches on either side of the feet and about a foot in front of the feet.
This will be a demonstration of a step 2 3-point gait pattern on crutches. Notice how she will advance the crutches first and then steps with the weaker leg while stepping to the line of the crutches with the strong leg and repeats the sequence. This would be appropriate for a patient who has a unilateral lower extremity weight-bearing restriction. Walking back, she is demonstrating a step through 3-point gait pattern because her point of contact is past the crutches. Notice how she advances the crutches first, then steps with the weaker leg, while the stronger leg steps past the crutches. Here's a demonstration of a 4-point gait pattern. This is less commonly used due to the coordination and focus required, but may be used as a starting point to teach patients the pairing of the opposite upper and lower extremities before using a 2-point gait pattern. This is a demonstration of a swing 2-point gait pattern. This requires the weight-bearing status to be full weight-bearing of at least one lower extremity. The patient moves both crutches while bearing weight through the upper extremities and advancing the stronger leg forward, creating 2 points of contact. Here is the swing through version of a 2-point gait pattern on crutches. The patient moves both the crutches while weight bearing through their upper extremities and advancing the stronger leg past the point of contact of the crutches.
Okay, so this is a standard walker. A patient will use this when ambulating. The fit for it is kind of like what we talked about with the other ones. When their arms are down, we want the handles to be right about at the wrist crease, and then when their hands are on the handles, we want to have about a 30-degree bend in the elbow. It's important that the patient stays in the middle of the walker, not too close to the front, because that can cause the walker to tip forward, and not too far away in the back, because then they're leaning over.
Here's the demonstration for walking with a front-wheeled walker. The patient walks normally but needs to have relatively good coordination to maneuver the walker wherever they want to go. Here's the demonstration for a step 2 gait pattern using a standard walker. When using a standard walker, the patient needs to have good upper extremity strength as they will have to pick the walker up for each step, which can be very tiring for some patients who don't have the endurance to do that.
So this is a 4-point cane, what we call a quad cane. It has 4 points on the bottom compared to just a single point. Benefits of this is that it can stand up on its own and it provides a little bit more stability. Can be a downfall is it does slow down gait because all 4 points have to be on the floor at once. You can't do 2 to 4. It has to be set down fully first. So the fit for this is similar to all of the other ones. When not holding on, the handle should be at the wrist crease, and then when the patient's hand is on the handle, have about the 30-degree bend in the elbow.
This is a demonstration of a step 2 3-point gait pattern with a quad cane, with emphasis on keeping all 4 points of the cane in contact with the floor. Here's the step through 2-point gait pattern with the use of a quad cane, just like normal walking, but with more stability provided from the cane.
this is our single point cane, which as you see, the bottom of it only has one point. It's a little less stable than the quad cane, and if you take your hand off it, it will fall down. But it makes for a more fluid gait pattern. You're able to do a step through gait to keep a more natural gait. It does provide a little bit of stability, but it cannot take full weight bearing. Also, to get into how you hold the cane, you hold the cane on the opposite side from the weak or painful leg. So say a patient has a weak left hip, they're going to hold the cane in the right hand, and every step that they take, they're going to, every step they take with their left foot, they're going to move the cane along with that. That's for a step two, or a 2-point gait pattern. For a 3-point gait pattern, you would move the cane forward, take a step with the weaker leg, then take a step with the stronger leg. So there are 2 different gait patterns for using the cane. So we'll show you those now. So this is what the 2-point gait pattern looks like. And then this is what the 3-point gait pattern looks like.